Hello and welcome to another edition of NAFDAC and Your Health, brought to you by NAFDAC, the agency that has the constitutional mandate of safeguarding the health of the nation by ensuring that you patronize only wholesome and approved food products, drugs, cosmetics, medical equipment, and chemicals. My name is Amanda Ugo.
Today on NAFDAC and Your Health, we shall be tracing the trajectory that led to the banning of sachet alcoholic drinks and those in pack sizes of less than 200 milliliters up until the recent press conference where the NAFDAC Director-General at a press conference reaffirmed that the ban remains effective. And then we'll bring you the NAFDAC DG's precautionary tips to stay safe from cholera in the face of the outbreak of the disease in our society. Alcohol consumption among children is one phenomenon that the NAFDAC Director-General, Professor Mojisola Adeyeye, found very worrisome on her assumption of office at the regulatory agency in 2017, particularly the alcohol drinks packaged in sachets. The Director-General found the existence of sachet alcoholic drinks risky, and she promptly set machineries in motion to address the phenomenon.
When I got to this position in 2017, at top management meetings, they will mention sachet alcohol. I was, what is sachet alcohol? Then they explained to me that NAFDAC in the past has approved sachet alcohols. We started looking into that, and the public outcry was rising about sachet alcohols. And then I was at a place where I saw a pack of some sachets, almost like what you use for a breakfast bar. Very colorful, nice. And I said, is this breakfast bar cereal? They said it's alcohol. I said, what? So beautifully designed and so small that a child can put it in the pocket. And I said, what is the level? 30%. I said, 30% alcohol, beer has 7% or 8%. And now you have this in a nicely packed sachets, small. So we started discussing with our manufacturers that we need to find a way of getting out of this. We've met at the Ministry of Health, and a plan was developed that the volume, the sachet alcohol is different than even the volume of alcohol and the PET bottle that we use. So we decided to have a phased out approach, because bear in mind, unfortunately, there are people that are working in that industry. You cannot just shut it down overnight. So by January 2024, we will not have sachet alcohol again. And then the concentration has also decreased. And NAFDAC will stop registering, actually has stopped registering sachet alcohol or applications or approving them.
The utmost reason NAFDAC, under Professor Adeyeye's headship, among other reasons, took the step is to discourage alcohol consumption among children.
Because it is about the children. Our spirits, many of them are 100%, for adults. But generally, they are not as high as that for adults. But adults can listen and change their minds, that I will not do this, I will not do that. Or police can arrest them if they do what they're not supposed to do. But children, they don't know. So whatever we did was to protect our children, was to make sure that even our Okada drivers will not It will not be that easily accessible for them to just pop and throw away the pack. So underage drinking extremely important for NAFDAC, because we're supposed to safeguard the health of our people. And once a child starts drinking at an early age, the probability of that child becoming a drunkard is very high.
After this move, on the 18th of February 2018, massive campaign against underage drinking also commenced on the part of manufacturers and other stakeholders to show that the manufacturers do not support underage alcohol consumption. NAFDAC, also in the agency's campaign against drug abuse and excessive alcohol consumption, joined in the massive campaign. And then in January 2024, on the completion of the 5-year moratorium given to phase out the production and sale of sachet alcoholic drinks had elapsed, the Director-General held a press conference to alert the public that it would henceforth be against the law to sell sachet alcoholic drinks.
The National Agency for Food and Drug Administration and Control stopped the registration of alcoholic beverages in sachet and small volume PET and glass bottles that are below 200 ml, based on the recommendation of a high-powered committee of the Federal Ministry of Health and NAFDAC on one hand, the Federal Competition and Consumer Protection Commission on the other hand, and the industry also represented by the Association of Food, Beverages and Tobacco Employers, AFBTE, the Distillers and Blenders Association of Nigeria, DBAN, in December 2018. So it is about 5 years ago when we had this high-powered meeting. As commitment to this decision that was reached at the end of this high-powered meeting, producers of alcoholic beverages in sachet and small volume PET bottles less than 200 ml agreed to reduce the production by 50% with effect from 31st January 2020, while ensuring the product will be completely phased out in the country by 31st January 2024. On the part of the agency, NAFDAC committed to ensure that the validity of renewal licenses of already registered alcoholic beverages in the affected category do not exceed 31st January 2024. We did not give any permit that exceeds that date.
After the press conference on the 31st of January 2024, NAFDAC began an enforcement exercise to ensure that the ban became effective, and the status quo had remained the same until recently, when publications in some national newspapers and a television station purportedly announcing the lifting of the ban on the sachet and pack sizes below 200 milliliters of alcoholic drinks necessitated another press conference by the NAFDAC Director-General on Thursday, 13th of June.
On February 1, 2024, NAFDAC started the enforcement of the ban on alcohol sold in sachet or in less than 200 ml PET bottles after a 5-year moratorium that the then Honorable Minister of Health, Professor Mojisola Adeyeye, gave the manufacturers to phase out the 2 package types, that is, sachet and less than 200 ml PET bottles. Those are the 2 package types that we gave 5-year moratorium to the manufacturers in 2018 to phase out. The moratorium document was signed in December 2018 by the Distillers and Blenders Association of Nigeria, DBAN, and the Association of Food, Beverages and Tobacco Employees, AFBTE, with Ministry of Health. The moratorium was signed with the Ministry of Health, NAFDAC, and the Federal Competition and Consumer Protection Commission, FCCPC. Soon after the enforcement, in February 1, 2024, which came again 5 years after the moratorium, the House Committee on Food and Drug Administration advised that the agency should suspend the ban. It was made known at the time, however, that the agency will have to await a decision by the Ministry of Health and Social Welfare on the matter, since the agency was essentially enforcing a ministerial directive. On Thursday, June 13, 2024, last week, the Speaker of the House of Representatives called for a meeting with the Director-General, myself, at the Speaker's office. The Speaker was represented by the Chief of Staff, Professor Jake Dan Azumi. Present at the meeting were the Chair of the House Committee on Food and Drug Administration, Honorable Mrs. Regina Akume, the Deputy Chair of the House Committee on Food and Drug Administration, Honorable Uche Okonkwo. Also present are Honorable Chinedu Oga and Honorable Philip Agbese. Accompanying me to that meeting was NAFDAC's Director of FCT, Mr. Abdul Salam Ozigis. The agency was again advised to suspend the ban, and I responded by saying that it is a ministerial directive and that I had not received that directive by the coordinating minister to suspend the ban. The Speaker's representative at the meeting, Professor Dan Azumi, and the committee chair, Honorable Mrs. Akume, then said that the coordinating minister of Health and Social Welfare should write a memo to the Speaker and House Committee. Professor Dan Azumi said that the discussion will continue in July after the House returns from recess. Following the meeting, I reported the above outcome from the meeting to both the coordinating ministers of Health and Social Welfare, Professor Mohammed Ali Pate, and the coordinating minister of State for Health and Social Welfare, Dr. Tunji Alausa.
The NAFDAC DG also added that the ban on codeine-containing syrup has not been lifted and the status quo remains.
On May 1st, 2018, the then Minister of Health, Professor Isaac Folorunsho Adewale, placed a ban on codeine syrup because of a documentary by the British Broadcasting Corporation, BBC, on poor distribution of the codeine syrup, and also the abuse thereof. Codeine-containing syrup remained banned since that time. In fact, the federal government compensated the manufacturers of the syrup that did not abuse the distribution. NAFDAC has never discussed the removal of the ban. NAFDAC has never discussed the removal of the ban, meaning the ban is still in place. Therefore, the publication that said that NAFDAC has removed the ban is inaccurate and it is false. That needs to be clarified, that we did not ban on codeine. The ban is still in place. The ban has not been removed. What the newspaper said is that NAFDAC has gone back because there's a new minister in town that has unbanned the ban. There is no minister that has talked anything about the ban on codeine. So, the ban on codeine containing syrup remains so. Now, for the sachet alcohol, it remains until the ministerial directive is changed.
By this conference, the members of the public now have a reaffirmation from NAFDAC, the only constitutionally authorized regulatory body controlling Food and Drugs Administration, that sachet alcoholic drinks and those packaged in PET bottles of less than 200 millimeters remain banned in Nigeria.
You have been watching NAFDAC and Your Health. The program continues shortly. Don't go away. Welcome back. You are still tuned to NAFDAC and Your Health.
Cholera is an acute disease that can kill within hours if untreated. It is caused by eating of contaminated food, inaccessibility to safe drinking water, basic sanitization, unplanned urbanization, and climate change. This outbreak of this disease in some parts of Nigeria and the increasing number of cases has challenged NAFDAC and other public health stakeholders. As an ever proactive and responsive agency, NAFDAC takes issues of public health so importantly, and in the case of the cholera outbreak, NAFDAC has been organizing fora to heighten its public enlightenment and sensitization activities geared towards mitigating the cases of cholera infections. The Director-General of NAFDAC at a press conference recently enumerated the causes of cholera.
If not because we have the regulation that we are having, or we've had rather, on sachets water, we will have had a lot of problems in Nigeria. But when you are controlling a market, you will always see people want to do shortcut, okay? And it may not be directly related to the sachet water, that we control. It may just be poor hygiene, sanitation, and in the environment. There are many things in our system that could cause cholera. Most people don't have water. They fetch water. They go and fetch water. And this is very true of almost all our families, extended families. When you use toilet, for example, people do tamba. You have to wash almost 15 minutes continuously to remove the germs. How many people have water running 15 minutes continuously? So it's a pity that we have the outbreak of cholera. It may be just sanitation. It may also be people selling bad water. We close shops, we close plants almost every day. So it may be due to many reasons. But our environment, the fact that we don't have pipe-bomb water, people manage water when they're not supposed to manage it, can cause cholera.
The NAFDAC Director-General, while fielding questions from pressmen, also spoke on the best way to preserve food through refrigeration to avoid spoilage.
It is when you cook food and you put it in the fridge for more than 3 days. Refrigerator, not freezer. Because somebody called me yesterday, we shouldn't keep food in the freezer for more than 3 days. No, you can keep food in the freezer for 6 months if you have continuous electricity. If not, because if there is power failure, you defreeze and freeze, you defreeze and freeze. That is a shortcut for spoilage, But for cooked food that you put in the freezer, it shouldn't be more than 3 days. If it's if it's going to second day or something, or third day, you have to put it on the stove and heat it up. If not, and heat it up well, I hope I answered your question, but it is not in the freezer for 3 days. It is in the freezer, it can stay for months if the electricity is stable.
This is all we have for you on today's edition of NAFDAC and Your Health. Join us again next week for another informative and educative package. You can also help NAFDAC safeguard the health of the nation by supplying us with every information you have on the activities of peddlers of unwholesome and unapproved food products and other regulated products. If you have any information or inquiries, please reach out to us.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700-162-3322. For complaints, call 0800-162-3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Please note, it is criminal to import, produce, distribute, market or sell unwholesome, unapproved or counterfeit food products, drugs, cosmetics, medical equipment and chemicals. Let us join hands with NAFDAC to have a healthy nation. Till next week, stay safe.